Greg Stanley. I'd like to talk about something today that might clear up some mysteries that you've encountered before relative to managing your practice to higher levels of productivity. You know, so many of you have tried marketing, you've had associates that didn't work out, you feel like your staff are excellent, but it seems that the practice still never grows. Here's a little bit of information that might change your outlook on all that. We call this the patient commitment continuum, based on the idea that not all new patients to a practice really come in with the same level of commitment. In fact, they don't even come in at all. Some of them only call in and never show up. So patients are different. They fall along this continuum all the way from a returning old patient. That would be the highest level of commitment. They know you well, they like what you do, they're very comfortable in your office, all the way down to somebody who walks into your office with a coupon in their hand or maybe just saw your sign and pulls in. Let's look at the continuum a little bit closer. Like I said, out at the right you might have returning old patients, family members of existing patients. They come in with a pretty strong referral and have a relationship with your office through another patient. Then would be strong referrals, maybe somebody they work with or good friends. Then what I would call a casual referral. Somebody might have even overheard that this person just returned from the dental practice and asked them, how did you like this office? And they might tell you, yeah, it was pretty good, or it's about like what you would expect. Then maybe someone with a coupon in their hand that was sent to them in the mail. Now that's lower commitment, obviously, but at least there's some tie to the office. That coupon creates that tie. Finally, somebody who just drove by and saw your sign and knows they need a dentist. Do you realize that this continuum doesn't just reflect patients' varying levels of commitment, but it reflects the need of staff commitment and motivation, scripting and systems to accommodate these different levels of commitment. We might take a staff person brand new to dentistry, a week or two in the office, never worked in another office before, and they can take one of these returning old patients and do pretty well. As you start moving down the continuum, even experienced staff have trouble. Maybe the experienced staff have trouble with the motivation, meaning, yeah, they know how to handle patients, but now we have this weak caller on the other end, this patient who isn't that committed, and I really don't care if they come in or not. We have a lot of referrals here, and this doctor of ours is running these promotions all the time. I think I will screen these people by just not reaching out to them. So you can run into the problem of skill, motivation, commitment, but this explains a lot of the mysteries. For example, you bring an associate doctor into a practice. Now this doctor is an associate for a reason. Maybe he's been in practice 10 or 15 years, had his or her own practice, and decided it really wasn't just what they want to do. They still want to do dentistry, but they don't like the stress of running an office. So they come to work for you. So here's a person many times with marginal commitment, maybe even limited communication or selling skills. And who do we match them up with? Well, all of the strong referrals and returning old patients, they want to talk to you, the owner doctor. So we tend to take these coupon or less committed people and put them with what might turn out to be a less committed, capable, or motivated doctor. Can you see that would be a difficult combination? Some of you may be asking, well, how in the world would you ever hope to survive a weaker doctor put with a weaker patient? Well, I can tell you right off the bat that the cases tend to be so small that this usually is an unprofitable venture. In short, it takes better staff, better systems, that is scripting, checklists, etc., probably leadership oversight in some cases, to get the associate doctor to produce like the owner doctor, and to do it with these marginal patients. So you can see now possibly why some of your best efforts of the past didn't turn out the way you had hoped.